This month, Breast Cancer Awareness Month. Here to tell us a bit more about breast cancer and some services offered at the Northeast Tennessee Department of Health is the department's Family Health and Wellness Director, Mary Williams. Mary, thanks for joining us here on First at 4. Well, let's start out. Obviously, October Pink has become synonymous with breast cancer awareness. Breast and the cervical program there. Describe that program.
Okay, the breast and cervical program is a program that offers Tennessee women access to breast and cervical cancer screenings. We also have funding that allows for diagnostic testing for men, and we also offer patient navigation to help patients overcome healthcare barriers and to gain access to treatment and care.
Well, who should get these kind of services, these breast and cervical screenings?
For cervical cancer screenings, women ages 21 through 65 should have a cervical cancer screening, which would include a pap smear cytology and an HPV test, or both.
All right, and eligibility, you touched on that a little bit. Describe how important it is to get these screenings, to have yearly exams, and keep an eye on your year-to-year health.
Well, women ages 40 through 49 should have a mammogram screening every other year, and they should talk with their providers to decide if testing at that age is optional for them. And women ages 50 through 75 should have a mammogram every other year or more often. And then there are certain circumstances that women should have more frequent testing or mammograms, and that's a conversation that should be had with your provider to find out what's right for you.
How has the breast and cervical program positively affected Tennesseans? Certainly we've come a long way in staying ahead of this fight, and here in Tennessee we're at the top of that list.
Yes, in 2023, the breast and cervical program offered over 14,600 breast services and over 5,700 cervical services to Tennessean women. And of course, these screenings, when they're done, they can find cancer at an early stage where there are more treatment options and where the likelihood of survival is improved.
Absolutely. Have to stay on top of that. Where can we find more information? If we want to take that first step, if we want to continue to maintain, perhaps life circumstances have changed, where do we go to begin this kind of screening and testing?
You can always contact your local health department, or you can contact the Tennessee Breast and Cervical Screening Program at 877-969-6636.
Mary, what's one bit of advice you would give to someone who maybe hasn't got their first screening or taken that first step to get them kind of over the hump and start being aware of their health?
Early detection is the best cure, so everyone needs to be screened.
And we're talking, really the age range on these different programs is 21 to, 75 and up. So, Mary, thank you very much for what you do, not only in the month of October, but year round to keep us safe.
Thank you.